Hello everyone, this is Dr. Archita Garg. In this video, we will be having a brief overview of radiology as a branch after NEET PG. So there are certain pros and cons of radiology, and we will be seeing them one by one, discussing them. And let's begin. The first pro with radiology is that it's an end branch, and since it's an end branch, it is also providing early settlement. And we should know that most of the other branches like MD medicine, MS surgery, and even nowadays MS ortho, there are a lot of other things that are required even after doing your MD degree, like for example some fellowships, and especially with medicine and surgery, you have to go for a DM or a MCH course after that. And considering those things, radiology is free from all those problems. It's largely an end branch. There are certain options even after doing a MD radiology, but I know even doing a 3 year MD radiology, you can get many job opportunities. For example, I know this friend of mine who did 3 year MD radiology from a good college, and then he took up a job in a very good private hospital, and his starting salary was 5 LPA. Then I think it has a very good lifestyle also. Even if you see the residency that is there, it's not very hectic. Okay, as compared to other branches, especially if you compare it with a surgical branch, the residency is not too hectic. So it's a balanced kind of lifestyle. Yeah, you get a lot of work life balance also. Okay, so that is one thing. And the earnings, as I already mentioned, that even the starting salary can be up to 5 LPA, and that is a very good thing because many people do not want to do any further super specialization or something. Okay, so that is very good. Job opportunities. See, radiology is having many job opportunities, and as many hospitals are opening up, even the government hospitals, the private hospitals, all those are providing jobs to the radiologists that are there. The salary, as I already mentioned, is good. So many people who cannot or who do not want to set up their own practice somewhere, okay, they can just take a job somewhere and they will have a decent lifestyle also and decent earnings also. So let's look into what are the cons of radiology. I would say the first and foremost is lack of patient exposure. See, radiology is basically, you there is suppose that, for example, we consider a scenario. There is a file that comes to you, and the patient's details are given there. That a very brief history is given, and you read that, and you look at the film on your screen, and you make a diagnosis. Yes, this is the problem. So that is, uh, something that does not require any kind of patient exposure. Okay, and second thing, only diagnosis. There is no treatment. No, to be no very clear here. I am talking about a 3 year MD radiology course, not going into interventional radiology or radiotherapy or something like that. Talking about a 3 year MD radiology course, it offers only diagnostics. Okay, there are no treatment associated with that thing, and so you might feel a lack of satisfaction because simply making a diagnosis each and every day can you know uh, you know uh, takes you away from being a clinician. See, radiology is picked up by the top minds of the country, the top rankers, the top minds, the most intelligent people, who I believe that actually wanted to be very good clinicians. So radiology is far from being a clinician. It's you just sit inside a closed room. You suppose that you get the file of the patient that yes, the patient presented with this problem. Some examination findings would be there, but mainly you have that X-ray or a CT or MRI film in front of you. You just look in it and you make a diagnosis. Now, how the patient presented, how the patient was treated, how he was followed up, did he become all right or not? You do not have anything to do with that. So, lack of satisfaction can be a problem in this branch over long term. If you look for a long term, over 2 years, 3 years, you might feel that, like that you are only making diagnostics, you're not doing any treatment. Third thing, as a con, I would say is less fame. See, radiology is not having that much of a fame and name for a doctor that if he or she wants. Definitely, radiology is having a very good name among the doctors. So that is one thing. But if you see overall, like in general public, the radiologist, although the, as I said, top minds of the country, but not having too much of a name and fame. So that can be a problem again over the long term. You might be doing long duty hours. You might have studied so much, and now you're not being recognized by people. So that is one problem. Branches with a lot of fame, I would say the first and foremost is MD medicine. Okay, MD medicine, not just plain MD medicine. If you do a DM course after that, especially DM gastro, DM endocrine, DM nephrology, these are having a lot of fame. Okay, if you are practicing in a city, almost everyone knows that yes, this is the person, this is the doctor that is there. Okay, another branch with a lot of fame is MS of gynae. Okay, MS of gynae having a lot of fame. People know you by name that this is the doctor there. And also MS surgery. Nowadays the craze for MS surgery has gone down, but no, that is also having a lot of fame and name. Uh, Fourth point I would say is cap on income. As I said that you have early start and you have very good earning also the initial price, the initial salary that you are getting is very good. But if you see over the long term, okay, that income becomes static. Matlab, as I already mentioned, this friend of mine that who is earning a salary of 5 LPA. Now he has been practicing there for 2 years. It has been 2 years for him, and still the salary is 5 LPA only. Okay, who's a senior of his department. He's earning a salary of 7 LPA. Okay, and is a very experienced radiologist. So you can see there is a cap. Like that person, the most senior person in his department, could not go above 7 LPA. Whereas if you could consider other branches in which if you're having a very good practice, people know you, then there is no limit to the income. Especially the branches which I mentioned earlier, like medicine, okay, medicine, obgyn, surgery, orthopedics, even pediatrics. So these branches are not having any cap that this is the maximum earning you are going to get. Because in these branches you are having your own private practice. Okay, so you can set the number of patient that you're going to see in a day or number of surgeries that you're going to do in a day. So that is another thing. Own setup is very expensive in radiology. Okay, having your own setup, if you see uh, the CT machine, MRI machine, these are very, very expensive machines, and even after you buy them, the maintenance that is there, and if some problem occurs, you know, that can cause a havoc in your practice that is there. So, be very much informed that mostly radiologists they take up a job in some hospital and they practice there. Then sixth and the last point I would mention in the con is AI. Okay, artificial intelligence. But many people say that AI won't be replacing radiologists, which I believe is partially true because with the advancements in AI would surely be making some of the diagnosis that is there. But since the medical legal issues are involved, radiologists would still be needed. But the number of radiologists that would be required will significantly go down. So job opportunities will decrease accordingly. Overall, I would say radiology, one of the most high yielding branch that is there. That is one reason why the toppers take radiology. It's having a very good lifestyle, good work-life balance. But be informed that there is a cap on everything. For example, your name, your fame, the money that you're going to earn, everything will be early, but that won't grow as you proceed in your life. There are many radiologists I know, my friends who have been practicing for like 3 years, 4 years, and the kind of frustration sometimes develop from not getting that recognition. It it can be very very frustrating at times. So these are the pros and cons. I hope you like the video, and in the next video we'll be coming up with the branches. What are the pros and cons?